Imagine you're standing in a crowded room. You're perfectly conscious. Then suddenly, something feels wrong. Your vision starts narrowing. You feel hot. Your ears begin ringing. You become sweaty and nauseous. And before you can even figure out what's happening, you're on the floor. What just happened? Did your brain shut down? Did your heart stop? Or did your body actually faint on purpose? The medical word for fainting is syncope. And at its simplest, fainting happens when the brain temporarily doesn't receive enough blood flow to keep consciousness going. Think of your brain as an incredibly demanding organ. It needs a constant supply of oxygenated blood. If blood flow to the brain suddenly drops far enough, consciousness can disappear. And because the problem is usually temporary, consciousness often returns quickly once normal blood flow is restored. Here's where things get really interesting. Sometimes your body doesn't faint because something catastrophic is happening. It faints because its automatic control system overreacts. This is called vasovagal syncope. It can be triggered by things like seeing blood, having blood drawn, intense emotional distress, pain, heat, or standing for a long time. Your autonomic nervous system normally helps regulate things you don't consciously control, like heart rate and blood pressure. But during a vasovagal episode, that system can produce a sudden drop in heart rate and blood pressure. Blood vessels in the legs can widen, allowing more blood to pool lower in the body. Less blood then returns to the heart. Blood pressure falls, and the brain temporarily gets less blood. Imagine someone donating blood. They're sitting there calmly, but then they see the needle. Their stomach suddenly feels strange. Their face becomes pale. Sweat appears on their forehead. Their vision starts narrowing. They feel like they're about to disappear. This isn't just something from movies. Fainting like this is far more common than most people think. Researchers estimate that up to 40% of people will faint at least once in their lives. And here's the fascinating part. It's not necessarily because the person is weak or simply afraid of blood. Cardiologist Dr. Sue Corcoran, who researches syncope at Melbourne's Baker Heart and Diabetes Institute, has explained it this way in an interview with Healthline. When we're frightened or in emotional distress, our body releases adrenaline, one of our fight or flight hormones. Normally, that hormone helps us run from danger by sending blood toward our legs. But if there's no danger to actually run from, that same reflex can send too much blood downward and too little blood up to the head. Corcoran notes this may help explain why an estimated 3 to 4% of people faint specifically at the sight of blood, a distinct, well-documented trigger of its own. Now comes the strange part. Why does someone who is standing suddenly collapse onto the floor? Because gravity matters. When you're standing, gravity makes it harder for blood to return from the lower parts of your body to your heart. If blood pressure drops significantly while you're upright, the brain can receive less blood. But when you fall down and become horizontal, gravity no longer pulls blood downward in the same way. Blood can return toward the heart more easily, helping circulation recover. In a strange way, the fall itself can help reverse the problem. If you feel like you're about to faint, don't try to prove that you can push through it. Get somewhere safe. Sit down or, preferably, lie down. If possible, raise your legs. Mayo Clinic recommends lying down or sitting down when you feel faint and advises not getting up too quickly afterward. If you can't lie down, sitting and lowering your head can help while you wait for the feeling to pass. There's another trick worth knowing. Researchers who study fainting have found that tensing your leg, stomach, and buttock muscles, or crossing your legs and squeezing them together, can raise your blood pressure within seconds. It's called a physical counterpressure maneuver, and studies show it can sometimes stop a faint from happening at all, simply by pushing blood back up toward your heart and brain. And this is the part you should never ignore. Not every faint is a simple faint. Fainting can sometimes be associated with heart problems or other serious conditions. That's why doctors don't simply ask, "Did you faint?" They want to know, when did it happen? What were you doing? Were you exercising? Were you lying down? Did you experience chest pain or abnormal heartbeats? Did you injure yourself? Did you recover normally? Mayo Clinic notes that fainting during exercise, fainting with certain heart symptoms, or fainting in someone with a history of heart problems can be more concerning. Cardiologist Dr. Elijah Baer of Mayo Clinic Healthcare describes fainting as a temporary loss of consciousness caused by insufficient blood flow to the brain. But doctors also have to determine why the blood flow dropped. That could involve dehydration, a sudden drop in blood pressure, medications, a vasovagal response, or, in some cases, a heart rhythm problem. Dr. Baer notes that age matters, too. Older adults are more likely to have undiagnosed heart disease, which is one reason doctors take a loss of consciousness more seriously later in life. He also points out something else doctors watch for. Fainting can sometimes look like a seizure. Telling the two apart often requires both a cardiologist and a neurologist. Doctors may use an ECG, blood pressure measurements, blood tests, heart imaging, or other tests depending on the circumstances. Narrator: so the question isn't simply, why did I faint? It's, what caused my brain to temporarily stop receiving enough blood? So the next time you hear someone say, I almost fainted, remember what may have happened inside their body. It wasn't necessarily weakness. It wasn't necessarily fear. And it wasn't necessarily something harmless. It may have been a temporary failure of blood flow to the brain caused by a powerful reflex. Understand the danger. Know what to do. Pause. But that doesn't mean fainting should automatically be dismissed, because the same symptom can have completely different causes. Narrator: and that's why understanding your body's warning signs can sometimes be more important than understanding the faint itself. This video is for general education and isn't a substitute for medical advice. If fainting is new, recurrent, or happens along with chest pain or an irregular heartbeat, it's worth getting checked out by a doctor. Subscribe for more explanations of what happens when things go wrong and what you should do about it.